Welcome to Life is Beautiful.
Thank you so much.
First of all, tell us, how is your heart?
My heart, my heart is good. I love my heart. It is healthy, I guess. Sometimes it is a little restless because it wants to do too many things. So it is into a lot of planning. Sometimes little more.
What do you do to take care of your heart?
On a physical level, I get up early. I do some exercise. I go to gym and I watch what I eat and I don't smoke. And on emotional front, I try to meditate. I try to tell my heart that cool down.
Can you tell me about your journey to this profession?
I was a little child when I used to see this senior doctor, uh, family physician of ours, who would come to our house and he would see my great grandparents. And I used to see, what a silence we used to observe and how much respect that doctor would get. All my uncles, my parents, they would know there was a pin drop silence and we were not allowed to make any noise. And people would go and pick them from the car and drop them back. And oh, I thought this was the profession that this gentleman came, did something, and there is an improvement in the health, and everybody has so much of respect for this person. So maybe I should try something similar.
Now, what inspired you to be a heart specialist?
A heart specialist. Frankly speaking, my wife. In fact, let me tell you, I was more keen to become a psychiatrist, and I always was inclined towards psychiatry. And I thought that most of uh, general people were suffering from some or the other ailment related to psychiatry. But as I was just about to choose between the two branches, I asked Anjali, my wife, that you would like to become a wife of a cardiologist or a psychiatrist. And then she said, if there was a choice, then a cardiologist. Then I decided, okay, cardiologist. So the cardiology was my second. In cardiology also you need to understand psychology in any case.
What can you say about the heart disease in Nepal? Is it rising sharply?
Unfortunately, yes. I mean, while all the developed countries now are witnessing a decrease in the incidence of heart disease since last 1 or 2 decades. On the contrary, it has been on the rise in the developing countries like Nepal. And it is pretty unfortunate because we do not have as many developed cardiac centers or trained manpower, and it is very expensive. But yes, today the incidence or the prevalence of heart disease in Nepal is almost 7 to 8% amongst adults in urban.
Can you tell us what are the major reasons behind heart disease among Nepalese patients?
Definitely lifestyle. We do not realize how important is the health in our priority. Also, I think we give too much attention to what our tongue likes and we forget what our heart likes. And we just want to party, we want to forget when we are eating whether it is good or not for our health. Smoking is rampant, exercise is minimal, and there's a lot of stress, there's a lot of competitive feeling. So there are a lot of addictions, and all this put together leads to this disease called as coronary artery disease.
How can a healthy person prevent heart disease?
Well, I would like to put that as a mantra. I want that all of us, before we retire in the night, could ask ourselves, uh, have I made my day today? You know, so that word MADE, made, could possibly tell us or remind us about four most important things that we should do. And M is mental relaxation. A stands for avoid tobacco. D is for diet control. And E is for exercise. I think this MADE, made, possibly include all the important things that one should look into while trying to avoid heart disease.
Now, the modern world is constantly working hard to eliminate or to cure heart diseases. Can you give us the picture of past, present, and future of the progress?
Oh yes, definitely, tremendous. I think it was somewhere around 20 years from now when the real cardiology began all over the world, when the regular use of balloons and stents, um, stents were introduced a little later, but then with the angioplasty, the blockages of the blood vessels inside the heart could be opened up. And that led to a totally different science that is called interventional cardiology. In Nepal, we started this around 10 years ago. So we are not far behind. But I tell you that, 10 years ago, almost all patients who wanted to get themselves properly treated, they were forced to go across the border to New Delhi, to Mumbai, to Singapore or Bangkok. And now there's hardly any need for anybody to fly out because we in Nepal are now capable of handling all those situations. So it has been a tremendous improvement. The only problem is it is expensive, and there are very few centers which have these facilities, and there are very few trained cardiologists who can do these procedures.
What can you recommend to Nepalese family who usually go to hospital when no problem occurs?
You know what? We all need to understand that eventually all of us, as we grow, we will develop some new disease. And unless we make an attempt to diagnose them in time, it would be too late when the symptoms would come. Then you really are not left with many options. So therefore, an annual or 6 monthly checkup with doctors with basic things like your blood pressure checkup, your cholesterol checkup, your sugar checkup, your weight, your waist circumference, what we say that you should know your numbers, not just your bank numbers and your tax numbers, but you should also know your numbers of your health, what target you should have. Then I think there is a likelihood that you would not get into a big problem all of a sudden.
Heart disease is a very expensive disease and it's very expensive to cure, and there is no health insurance in Nepal. So what would be your recommendation to the government of Nepal to ensure most people have an access to healthcare?
There is no government in the world which can provide a free healthcare to all its citizens. Not the most developed and the richest countries in the world, forget about Nepal. I think we'll have to get into a system of some health insurance, and we'll also get into a system where people get more and more aware and take their own responsibilities, like you and me talking like this, and there can be many such programs where we can improve the awareness amongst general public. But then at the government level, of course, there should be adequate number of trained people, nurses, technicians, doctors, and they should be properly placed, not just concentrated in Kathmandu, but around the country, and do something to prohibit the use of tobacco and to get some easy access to places where people can go and walk, the community places, the gardens, which we do not have many. So I think there are a few things which government can do, and there are a lot of things that we all can do at our individual level.
Nepal is participating every year to mark World Heart Day. What is the objective of this program?
Yes, since last many years now, on a regular basis, not just Norvik Hospital, but many institutes in Nepal are participating regularly. The prime objective is same, to increase the awareness, to tell people to how to live healthy, and to avoid developing such a not only expensive, I would say largely incurable disease. And I am glad that there are there's a lot of progress which has been made, and I think people do realize now, and there has been some change that we have seen in terms of awareness.
Lately, there are news of the negligence of doctors behind preventable death, and ironically, people do not hesitate to vandalize the hospitals. So, do you think that there is a decreasing moral responsibility in all professions?
This may be partly true, but at the same time, destroying things and beating doctors or health manpower doesn't take anybody anywhere. It doesn't help. The implications would be that people would now get more security guards rather than improving in their health care. So, if you take that pathway, it is not good. However, let me tell you that possibly the 10th commonest cause of death in the United States is medical negligence or side effect of a treatment. Now, obviously, in Nepal, also once in a while this can happen. So what should be done is that, adequate amount of inquiry should be set in by experts, and accordingly some legal action should be taken. That is the only way to go about it. I think it is high time that doctors obviously need to understand that they are not gods, and they should try their best and accept their mistakes when it does happen. At the same time, public should understand again that the doctors would try, but they are not God, and sometimes this would happen. Many times, patients or their family members would not even realize how many small errors have occurred. There are very few percentage of errors which are actually caught by the family members. So there should be more stringent mechanism that all the errors are caught as much as possible and they should be addressed, but by a proper legal system which does not threaten anyone of life or damage of the property.
I know that you're a very busy doctor and you meet a lot of patients. So, what do they expect from you or any doctor?
You know, primarily a patient expects attention, first of all. So, I need to avoid talking to somebody else or taking my cell phone when I'm talking to my patient. And then, of course, they need time. So they need that, I should give them enough time and also that I'm available. So I think availability, time and attention, focus are the important things the patient requires. Some amount of sympathy, some amount of attachment. I have seen that once I start believing that this could be my own uncle and it could be on my own family, then automatically all those things would come out from a doctor. So you just need to figure out that suppose it was my own family member going to some other doctor, what I would expect from that doctor. Similarly, I should treat this gentleman who is sitting in front of me. And I think that works.
And at last, what would be your message to the would be doctors?
I would like to tell all the young doctors who are getting into this profession that they have chosen a wonderful profession. It will tell you that money is not only thing. Once you get respect and once you get satisfaction in what you are doing and what difference you are making in somebody's life, it will give you immense amount of satisfaction. One very basic important thing is that you should complete your training. There should not be any tendency to chase for money or to be greedy. So my uncle used to say that no earning without learning till you are at least 35 years. That essentially meant that please continue learning for a very long time. Now, this is a profession that needs a lot of training and therefore you are not into money making business very early in your life. But again, if you just try to get yourself properly trained and enjoy your work, then you will find maximum satisfaction in this profession. Wish you good luck.
So, at last, why life is beautiful to you?
Well, life is beautiful because it is largely unpredictable. And I think every day comes with a new opportunity and you handle the situation as it comes. And again, when you sleep, you realize that there will be some new things that would welcome you next day. That makes life, this life, very beautiful.
Thank you, Dr. Rawat,
Thank you so much,
for your
Prabha.
precious time.
Thank you.